Ever pondered if your body is communicating with you? Our bodies always whisper to us in a language of signs and symptoms, indicating our well-being. Often these signs are subtle, possibly hinting at something not being in perfect alignment. They could range from minor discomforts like persistent headaches to more significant health issues. In this video, we're decoding 15 distinct signs your body may be warning you about. We'll explore these signals, understand their meanings, and how to respond effectively. This knowledge can be key to maintaining a healthy lifestyle and, in some cases, could be life-saving. First, let's talk about persistent fatigue. More than just the typical exhaustion you feel at the end of a long day, this is a form of weariness that refuses to lift even after a full night's sleep. It's a deep-seated exhaustion that soaks into every aspect of your existence, clouding your mind and draining your energy. Next, let's talk about unexplained weight loss. Losing weight without trying might sound like a dream, but it's often a sign that something is off in your body. The third sign to look out for is unusual skin changes. From sudden rashes to unexpected changes in mole size or color, these are often your skin's way of signaling problem. In fourth place, we have persistent cough. A cough that lingers longer than expected could indicate a variety of health issues, from simple allergies to more serious conditions like lung disease. Next on our list is shortness of breath. This is your body's way of telling you it's struggling to get the oxygen it needs. Sixth, we have abdominal pain that won't subside. This can be a sign of many different issues, from gastrointestinal problems to more serious conditions like appendicitis. Seventh, we have persistent headaches. These headaches are not the usual ones that can be solved by an over-the-counter pill. They are frequent, severe, and may be a sign of a more serious condition. Eighth, look out for changes in bowel habits. Sudden and persistent changes could indicate underlying digestive problems. Next, we have frequent urination. If you find yourself needing to use the bathroom more often than usual, it could be a sign of issues like diabetes or urinary tract infections. 10th, be aware of persistent thirst. This can be another indicator of diabetes or other underlying conditions. 11th, look out for vision changes. This could mean anything from retinal health issues to neurological conditions. Next, we have memory loss or confusion. These could be early signs of conditions like Alzheimer's or other neurological disorders. 13th, we have persistent or high fever. This is often a sign that your body is fighting off an infection or illness. 14th, take note of constant nausea or vomiting. This could indicate digestive issues or even conditions like gallbladder disease or liver problems. Lastly, persistent lymph node swelling. This could be a sign of certain types of cancers or infections. So, if you notice these signs persisting, it might be time to check in with your doctor. Firstly, let's discuss unexplained weight loss. This unanticipated, inexplicable reduction in body weight can be a severe warning sign. It's not about the latest diet fad or magic weight loss pill, but about losing weight without consciously making significant alterations to your daily routine. It could hint at health conditions ranging from an overactive thyroid to diabetes to certain types of cancer, or even digestive disorders like celiac disease or Crohn's disease. Remember, unexplained weight loss is not always a good sign. Secondly, persistent fatigue also ranks high on the list. It's not just about feeling tired after a long day, but about severe, unrelenting exhaustion that doesn't improve with rest. It can be indicative of various conditions, such as anemia, thyroid disorders, or chronic fatigue syndrome. Our third warning sign is unusual skin changes. These may include new moles or growths, changes in existing moles, or sudden onset of severe acne. These changes could be indicative of skin cancer or other dermatological conditions. Fourthly, we have shortness of breath. Difficulty in breathing can be a sign of conditions like asthma, heart disease, or lung disease. Next, persistent cough, especially if it lasts longer than a few weeks or brings up blood, can be a sign of serious conditions such as lung cancer or chronic obstructive pulmonary disease, COPD. The sixth warning sign is unexplained pain or ache. Persistent or recurrent pain should always be evaluated, as it could be a sign of anything from fibromyalgia to certain types of cancer. Our seventh sign is changes in bowel habits. Constipation, diarrhea, or changes in the size or shape of your stool could be signs of digestive disorders like irritable bowel syndrome, IBS, or even colorectal cancer. The eighth warning sign is persistent headaches. Frequent severe headaches can be a sign of conditions such as migraines, brain tumors, or aneurysms. Ninth on our list is changes in vision. Sudden blurred vision or loss of vision can be signs of serious eye conditions or neurological disorders. The 10th sign is unexplained weight gain. Sudden weight gain, especially if not linked to changes in diet or exercise, could be a sign of conditions like hypothyroidism or polycystic ovary syndrome, PCOS. The 11th warning sign is frequent urination. This could be indicative of diabetes or urinary tract infections. In the 12th place, we have difficulty swallowing. This symptom can be a sign of conditions like esophageal cancer or neurological disorders. The 13th sign is changes in mental functions. This could be indicative of Alzheimer's disease or other types of dementia. 14th on our list is unusual bleeding or bruising. This could be a sign of blood disorders, liver disease, or certain types of cancer. Lastly, the 15th health warning sign is persistent fever. If you have a fever that doesn't seem to be linked to a common illness like the flu and doesn't go away, it could be a sign of an underlying infection or another medical condition, such as cancer or an autoimmune disease. These are some of the signs your body might be giving you to indicate something is not right. It's crucial to consult a healthcare professional if you notice any of these. Remember, early detection is key in handling potentially serious health conditions. Let's dive into the 15 signs that your body may be warning you about potential health issues. Sign number 1. Persistent pain. This isn't just your body casually asking for your attention. It's a distress signal that there might be a problematic underlying issue. Be it an acute, sharp pain revealing an immediate injury, or a chronic, dull pain hinting at a long-term condition, understanding the language of pain is crucial. Sign number 2. Unusual weight loss or gain. Unexplained changes in weight, whether it's loss or gain, can be a sign that your body is struggling with a health issue. Sign number 3. Changes in bowel movements. Drastic changes in bowel movements can indicate potential digestive issues like irritable bowel syndrome or even colorectal cancer. Sign number 4. Persistent fatigue. Constant tiredness could be a sign of numerous health conditions, from anemia to chronic fatigue syndrome. Sign number 5. Chronic headaches. Regular, persistent headaches could be a symptom of stress or even neurological conditions. Sign number 6 is changes in skin. Unexpected changes in your skin like new moles, spots, or changes in existing moles could be early signs of skin cancer. Sign number 7. Frequent urination. An increased need to urinate can be a symptom of diabetes or urinary tract infections. Sign number 8 is persistent cough. A cough that doesn't go away can be a sign of lung conditions like chronic bronchitis or lung cancer. Sign number 9 is shortness of breath. This could be a sign of heart disease or lung conditions. Sign number 10. Changes in vision. Sudden changes in your vision can be a sign of serious eye conditions like glaucoma or macular degeneration. Sign number 11 is unusual lumps or swelling. These could be a sign of different types of cancer. Sign number 12. Constant thirst. Excessive thirst is often an early symptom of diabetes. Sign number 13. Difficulty swallowing. This symptom could be a sign of throat or stomach cancer. Sign number 14. Persistent heartburn. Constant heartburn could be an indicator of gastroesophageal reflux disease, GERD, or even esophageal cancer. Finally, sign number 15. Memory loss or confusion. These symptoms could be early signs of dementia or Alzheimer's disease. Remember, these signs are not conditions, but symptoms. Alarm bells signaling potential underlying health problems. They are not something to be brushed aside or simply endured. Always listen to your body and seek necessary help when you observe these signs, as they could potentially save your life. So, to summarize, we've discussed 15 possible signs your body could be sending to alert you about potential health issues. These include persistent fatigue, unexplained weight loss, constant pain without any observable injury, changes in skin texture, color, or appearance. sudden acne breakouts, unexplained rashes, changes in mole size or color, unexpected changes in appetite, cravings for certain foods, aversions to previously enjoyed foods, and frequent mood swings that affect daily life and relationships. Keep in mind that these signs are not definitive diagnoses, but potential indicators that something might be off balance within your body. If you persistently experience these symptoms, it's crucial to seek professional help. Remember, being attentive to your body's signals today could prevent serious health problems in the future. Stay healthy, stay aware.